Hello, everyone. My name is Jillian Parker, and today we are discussing advanced directives, which are a person's end-of-life wishes. It's not always easy to have this conversation, but it is important, especially while we're facing the COVID-19 pandemic. And joining me for some insight on this topic is Dr. Adam Herman. Dr. Herman, thanks for joining me today.
Thank you for having me, Jillian.
First off, I want to ask you just if you can explain exactly what advanced directives are.
Advanced directives are really a generic term that describe a set of different documents and discussions that you can have to have a proactive plan if you're to become more seriously ill or in a position where you couldn't speak for yourself.
Why is it so important for people to be having conversations about advanced directives, particularly during the COVID pandemic?
Well, I think most of the time we don't like to talk about these things, of course, and it's scary to think about a situation where you may not have the faculty or ability to make decisions for yourself. And that's why it's so critically important ahead of time to have a proactive plan, really, to describe, what are the types of things you're willing to go through, what types of things you're willing to endure for what outcomes and what benefits. And I think it's especially pertinent now with the COVID-19 pandemic, because when people get sick, and it's a small percentage that get very sick, things can change very rapidly. And you may find yourself in a position where you're not able to speak for yourself. So for that very reason, if you have strong beliefs about what's important to you, what you want your family or loved ones to know, this is the time to take advantage of that.
And how much trickier is that also because family members aren't able to come into the hospital and have those in-person conversations with you as well?
You're very right about that, Jillian. Right now, there's a visitor restriction at essentially all the hospitals in the area, and communication is that much harder if someone is already admitted into the hospital. So, our hopes and goals are that people are talking about these things and getting a sense about what their loved ones, especially those with chronic or serious illness, would want, because we may not have the luxury of an in-person meeting if they are admitted to the hospital and have serious complications.
What are some of the advanced directives people should be looking at? What types of requests can be outlined on these documents and questions answered?
It's a very good question. First, I just want to delineate between the different types of advanced care directives. There are three main ones that we think about. One is something called a living will. And this is not about your house or your finance. A living will is sort of some general guidance and directions about what's most important to you if you ended up in a certain condition. And sort of the very generic ones will talk about, if I am unconscious permanently, or if I have a terminal illness, then these are my wishes, or this is the guidance I would give. It's great for guidance, but it's not really something that stands up well, because it's very rare for people to meet the exact criteria of what's in a living will. What's more important is to take something like a living will and then have a discussion with your backup person or a healthcare proxy. So a healthcare proxy is another form that is really important for everyone to fill out. That identifies the person that will speak for you if you couldn't speak for yourself. For most people, that might be a spouse or a sibling, a brother, a child, an adult child. And I really think it's important for someone to pick who they believe will best represent their wishes and best understands their goals, what matters most to them. And then that may be one sibling and not another. It might be one child, not another. It might be your spouse. It might be a close friend. And that's really where we want to empower people to make their own decisions and determine who's going to be in the driver's seat or guide those discussions if we needed to have difficult discussions. So if you have a living will or a document to talk about that sort of gives general guidance, you can talk with Health Care Proxy to make sure that they understand your wishes in general. if something were to happen, and you were to become more ill, then they would have some guidance. But really, the final line of defense for you to be empowered to make your own decisions and have a proactive plan in the state of New York is to fill out a form called the MOLST form, or Medical Orders for Life-Sustaining Treatment form. And this walks through a series of medical interventions that can be done to you, but may or may not be desired depending on your current condition or comorbid illnesses or other health problems that you may have. On that form, we discuss things like artificial nutrition tubes or artificial feeding tubes in the stomach. We talk about coming back and forth to the hospital. We talk about, you can talk about things like dialysis. You can talk about things like breathing tubes and breathing machines. And you can talk about things like harsh heroic efforts like CPR or resuscitation in the setting when your heart stops.
You mentioned a few minutes ago that about the restrictions, visitors not allowed to be in the hospitals right now to visit some of these patients. So what are some of the challenges that both you as the doctor as well as patients and their families face if these directives are not filled out ahead of time?
I think the scariest scenario for physicians is really one where we have a patient who's coming in who is very ill. They have significant comorbid diseases like hypertension, diabetes, cancer, COPD, some of these other conditions that we know if someone had COVID and these other conditions and they fall into that group that get very sick, that they often will need artificial life supports like breathing machine and these other very aggressive supports. If we have someone who would otherwise have said, no, I don't want these things, the worst dilemma that we have as a physician is having to make a decision when we don't really know what the patient wants for themselves or what the person wants for themselves. The clearest, most direct way to communicate that information is by having a healthcare proxy, having spoken to that healthcare proxy, and if possible, completing a form like a MOLST form, especially for those who have more advanced or serious illness.
And you mentioned these forms. If someone's considering filling one out, how do they go about obtaining them, and who else might need to be present to do that? Is there an attorney that needs to be present? Do you need to contact your the doctor that you're working alongside with?
Sure, those are really good questions. This is a medical order form, basically. It's medical orders for life-sustaining treatment. So a doctor is the primary person that needs to sign this document. I recommend that you reach out to your primary care doctors or the doctor who you feel knows you best and maybe can talk with you about what the expectations would be if you became more ill and required these sort of harsh, invasive support treatments. And with that doctor and usually, some other person, family member, or your healthcare proxy present, you can complete these forms in person or virtually or by phone. It doesn't have to be that you have to sign the document, but there has to be clear understanding and someone else available to witness that this discussion happened. It doesn't require a lawyer. So this is really available to every person. You don't need to have a separate lawyer help you fill this out. And that's also true with a healthcare proxy. You really need to identify that person, and you need two people to sign that form, just not the person who's your healthcare proxy. That has to be two other people to witness that you're selecting a certain person to be your healthcare agent or healthcare proxy.
Okay, and a hypothetical, if a patient for some reason ends up having to go to another facility, a different doctor than is their primary care doctor, how will they know if that person will be able to obtain these forms? Is there a way to make sure that it doesn't get lost in the shuffle there?
That's a really good question. I would say that within Rochester Regional Health System, we've largely gone electronic, and so has the university system. We use similar systems. They don't talk completely, but if we do it within the system, it's often that those forms are scanned in, and literally I can go into the records and see that there was a discussion, what that was about and the decisions that were made based on those discussions, including the MOLST form.
How do you know if you're someone who should be considering this? Are there certain guidelines to be looking at, whether it is maybe how weak or strong your immune system could be, a certain age you might reach? What are the factors for considering filling them out?
Sure. Generally, the recommendations for filling out a MOLST form is anyone who might have a life-threatening condition, is more frail, or has multiple conditions that they seek and see doctors for. Those who already live in maybe an assisted living setting or a skilled nursing home or a nursing home setting really should have these forms filled out. With COVID, we know that if you have other illnesses like hypertension, diabetes, cardiovascular disease, heart failure, COPD, and you end up in the group that gets very ill with symptoms, which is a small group, but if you get in that group, the risks are quite high that you would not survive the hospital stay, even if heroic and harsh measures were taken. And so, especially for those people who already have an idea what would be okay and what wouldn't, it's really important for those people to get their wishes known and out there. And I think we too often think about these things as, well, if you can do it, then go ahead and do it. You know, if it's available, then I want it. There's a big difference between can and should. And just because we do these procedures doesn't mean that you'd return back to who you were before it occurred. And in fact, those with chronic conditions or other conditions alongside something like COVID really often end up in a place where they're much more debilitated, frail, or even can't leave the hospital or couldn't get out of a nursing home. And so I think it's really important to understand not just what the procedure is, but what's an acceptable outcome at the end of that journey.
I could imagine that for some people, you might not think about these documents until you're in a situation where you have to think about these documents. But really, I would assume the message here is to make sure that you look at them while you're still healthy before you get to that point.
I think that's critical. While you can speak for yourself and sort of hear it from the horse's mouth, so to speak, that's what the doctors like to know. What would you think about this scenario? That is the best way to communicate. And the only way to do that is really to be a little bit proactive. And it may mean stepping into a space that's a little uncomfortable for most of us to talk about. I think it can be, you can kick off those conversations by, stating, hey, with all this COVID going on, I want you to know my wishes if I were to get really sick. I want you to try aggressive measures, but I don't want to be left on a machine for a long period of time, or I don't even want to go down that path. I've had a full, long life, and I wouldn't want to go through those things to have you watch me suffer on machines or invasive procedures. And other people might say, during this time of COVID, I know it's really scary, but there are things I still want to be here for. And I want you to try everything, and unless I'm not going to come off the machine, or I'm not thinking, continue doing those measures. Each person is an individual.
An important question that I like to ask, because there are still those people that might not be taking COVID seriously. What would your message or word of advice be to those people?
COVID is a killer. And for those who get very sick with it, we are seeing some of the severe, serious, and deadly consequences of not paying attention to it. I think our community, we're lucky. I think we've done a relatively good job self-isolating and distancing. I am concerned that if we underestimate where we are right now, that we could see a lot more people come in and get very sick very quickly. We have an opportunity to take care of ourselves and take care of our loved ones by being proactive, by being thoughtful about how we spend our time and where we go. And I think we also have the opportunity to be thoughtful and proactive about what do I want for my own care in case I got into that situation. Young, old, everyone should have some thoughts about that. I do think it's particularly important for our older and frailer population to really give this some considerable thought. And it is scary, and that's why I commend anyone and everyone who is able to do that. It's really a gift that you're giving family to think about these things now, because it saves them from having the grueling uh, uh, thoughts of having to make a decision when they don't know what you really want.
Dr. Herman, thank you. This has been important information to get across. Is there anything else that you wanted to add that you think I might have missed?
I just wish everyone in our community safety and health. This is an extraordinarily difficult time. And I think as a community, we can get through this together and perhaps learn a couple ways to be more proactive about our own health in a situation with COVID where we may not have that much time between getting an illness and becoming very sick. It really makes us think about how we can change our behaviors and attitudes, hopefully going forward when we get through this pandemic, that we are proactive about our own health and we communicate how we feel about what's important to us and what matters most.
Dr. Herman, thank you so much for taking this time to be here with us today, and thank you for all you're doing as well. I really appreciate it.
Thank you so much.
You guys are good.